Good morning. This is Dr. Michael Triglia with Peninsula Chiropractic Center, and I'd like to welcome you to our Health and Wellness and Motivation Friday. Today is Friday the 13th. A lot of people look at that as a negative day. I say the most important 6 inches of your body is the 6 inches between the ears, because you can determine if the day is great or not. It's not a matter of luck or anything else. Now, don't get me wrong. There are days you have a temporary setback. But for me, Friday the 13th has always been one of my most powerful days of the year. I think that's because I try to help make it so. The last time we spoke a little bit about you being a pain in the neck, or actually neck pain. But today we're going to go down a little lower. But come on down, I want to show you what I'm talking about. First, we're going to go from my office down our hall, and we're going to come into room 1. And again, this is where we discussed last time about neck pain and the upper cervical problem. The next area I'm going to speak with is a lot of people who have low back pain. Probably 75 to 85% of our people come in with low back issues. Now, what we want to do is discuss why low back pain comes on when you have no idea why it came on. It's simple when you've been in a car accident or any of falls, accidents, injuries, to not understand how you have low back pain if you haven't had any of those injuries. Well, there are 3 primary reasons for low back pain. Let's have you take the test and you tell me if you've ever had any of these 3. Number 1, poor flexibility in the hamstrings. If you can't bend down and touch your toes and hold it for 3 seconds, you have a 90% or greater chance of having low back pain. And Tiffany, who's filming this, is laughing right now already before we get started. Number 2, weak abdominal muscles. If you can't lie on your back and do 30 bent knee sit-ups in a minute, you have a 90% or greater chance of having low back pain. And number 3, for every 5 pounds you have over your normal weight, you have a 90% or greater chance of having low back pain. So I know none of you probably have any of those 3, but I'm sure you may know somebody out there who does. So what begins to happen is over a period of time, the muscles of the calf and then the hamstring, the glute muscles, these gluteus and piriformis, these muscles of the butt, are very, very powerful and very, very strong, and they attach into the low back and begin to play tug of war each day with that spine. And what begins to happen if you're doing things like vacuuming or raking, sitting with your legs crossed, some people stand and shift their weight to one leg, sit too long at a computer, or vacuum or weed whack, puts tremendous pressure on the spine and the spinal muscles. And there are many, again, from the abdomen all the way around. That's why we work everything and all the muscles when we work full spine. So this can begin to play tug of war, pull the vertebra out of position, hit the nerve, and you begin to have dis-ease first. And as that starts, what I find is we had a sign in our office for a long time that said the 5 most dangerous words, or maybe it'll go away. We'll have this pain, but we'll try to push through it or work through it. But left undone, this dis-ease will continue on and become disease, an inflamed disc, an inflamed nerve, misaligned vertebra, disc thinning, bone spurs, osteoarthritis. All these things can occur over a period of time, not necessarily when the symptom came on did the problem come on. This is a small model, again, of any 2 vertebra, and I'm oversimplifying, but you have a vertebra, a disc, and another vertebra that controls the nerve. When that nerve is interfered with, again, you begin to have dis-ease. If you look on this side, this shows a small bulging disc, again, pressing on a nerve root, creating a problem. Conclusion, I just want to walk you over to our next room for a moment, so follow me to show you some of the things that we do. This is room 2, and Allison has created every room a little bit different because we feel it's more relaxing. And this is our special table that we can raise up or lower. Just turn it on here. We can raise this up to the height of the patient if they need it. And then it also can create a traction, a mild traction of the low back. It's a very gentle table. And then we have flexion distraction. This table goes up and down to lightly just stretch those very, very irritated fibers, as well as doing any therapy that we need. So today is Friday that I usually wear my Ravens, but I've decided to switch over because I love this country. As my dad served in the military and I served and my son served, we believe in this country first. So hopefully you can protest or do whatever you want about whatever you choose, but always choose the flag first. And as far as your health, please give us a call, 302-629-4344, if you would like a complimentary consultation because you're not sure chiropractic will help you. We're happy to share with you what we do and how we do it if it will benefit you. Dr. Bud and myself will be more than willing to chat with you. Just check with our front desk, check with Tiffany or Joyce for insurance. We have a team of people here to help serve you, to help you look better, feel better, live longer in the shortest amount of time. So have a fabulous Friday the 13th and a blessed weekend. This is Yours in Health, Dr. Michael Triglia.